used to create that vaccine. So the 25-26 strain is new and targets like the incoming kind of strains that they're anticipating. The Nuvaxovid, thank you very much, is the same formulation as last year. And I did talk to our infectious disease expert, the physician with infectious disease, and I said, there are a lot of people who are asking a lot of questions about messenger RNA. Hey, can I still recommend this protein base, even though it's still the same formulation as last year? And he said, like, yeah, as long as it's just used as a booster, it's a good booster. So if you want to still recommend that, that's completely fine. And, whether it offers the same level of protection, I don't think we know, because there just aren't those levels of studies right now, but it is available. So
do you suggest we get it?
I do.
Okay.
I do suggest you get it. And it would depend on whether you've had the original series of it or not. Whether you would need just one booster for this season or the full series. So, yes.
I have two questions.
Yeah.
One of them is, it's protein. If you have kidney issues,
Yeah.
will that affect your kidneys?
It really doesn't. So a lot of the current vaccines, this is kind of like what we would call like older technology. And a lot of our vaccines that are currently being made are this like protein-based model.
Second one is, I had Moderna 3 times. The first time I was down for 2.5 days.
Yeah.
The second time was a day and a half, and the third time was 2 days. If it's supposed to be a death virus, why did I become so ill?
So ill, it's just, that's a great question, because I had the exact same experience. And that may be one reason. Maybe you want to try you want it, that's fine. That's completely fine. You might. Yeah, right. So yeah, it just happens with this particular vaccine. A lot of people experience just that feeling of malaise after. I mean, it's high. Yeah. Oh yeah. You just don't get it.
Well, I was in the Pfizer clinical trial,
and just no.
I'm fine. Yeah.
That's wonderful. And so it is varied. I do hear a lot of people say that they have that side effect. And that's one reason my dad said he won't get it either. So I recommend that he gets the Nuvaxovid. I'm just terrible at this. I'm so sorry. Nuvaxovid. So I recommend that one for him because it's less likely to get that kind of icky feeling afterwards. But yeah, I'm not sure I could give you a really clear answer as to why that happens. The physiology behind that, pathophysiology, I don't think I could explain that. It's just that it is a common.
Okay, I had the 3 Moderna back in 21.
Okay.
So that's 4 years.
Sure.
So would I have to go back through the whole series again, or just a booster?
No, you would just get your booster at this point. You don't need to restart that series. Once you've done the series, they just say just a booster, and they do recommend an annual booster because COVID isn't seasonal like with flu. It'll peak with flu, but it also peaks in the summer. It's like this biennial type of peaking that we see because we're kind of seeing some cases start to peak now, but we also saw it in the summer. So we're still kind of trying to figure out when does it peak? When's the best time to get it? That kind of thing. Fall's a really good time. And then this last year they did recommend another booster. So it will wane. The effectiveness of this vaccine will wane.
I've had COVID twice since I got the shots.
Yeah.
Yeah. And something else, have you noticed any illnesses caused by COVID? Because now he's never had a heart problem.
No, I've got AFib.
And now he's dead.
It was after my 3rd shot, I got AFib.
Oh, interesting.
Yeah, so that's the other part of that.
Yeah. I would have to look into that a little bit more. It's not something I would necessarily. Let me look into it just a little bit more after the presentation.
I'm really cautious.
For sure.
When I have that, I'll probably have AFib forever.
Forever, yeah. Well, right. So these are just, I'll look that up for you afterwards if you don't mind.
Yeah, that'd be fine.
Yeah. And then we can look into that just a little bit more, but,
Is this available now?
yes, it is.
At Albertsons.
At Albertsons. Yeah, I recommend Albertsons right now because some of the retailers, because there's no clear guidance right now from ACIP, who's our kind of North Star for typical vaccine recommendations. So there's no clear guidance there. And a lot of the retailers are in multiple states. They have a lot of jurisdictions that they have to work under. So some of these retailers are requiring a provider prescription for a COVID vaccine. Albertsons is not. So that's why I'm just saying, no, I don't have a preference toward Albertsons, or I used to work for them, but I'm not trying to sell them in any way, but I just know that they don't require a prescription for you right now. So it makes it a little easier for you. Okay, so on to RSV. So RSV is another virus. This is a newer vaccine that came out 2-3 years ago. Kind of a variety. It's also changed a little bit with regards to guidance just based on some newer studies, but the recommendations are 75 and older. And then they did lower the age to 50 to 74 if you have an increased risk of severe RSV. So you can click on that link, see who has that severe risk, if you'd like me to do that. And then there's also a pregnancy recommendation as well for this 32 to 36 weeks gestational age to protect baby. Now this is just a one-time shot for pregnancy. So, it's not if a woman has multiple pregnancies, they just get that first shot. It's also a one-time shot for you all right now. There's no need for a booster right now. There are ongoing studies, but right now it's not showing that second dose is doing much. So just a one-time shot right now for the RSV.
And illness at all, like COVID that you got?
No, it's really not. Like I've talked to patients and it's just not that bad of a shot. It's kind of like your flu shot. You know what I mean? Yeah. So once in a lifetime, best time to get it, I mean, because it's a once in a lifetime, you can get it really whenever you want to get it. But recommendation, if you can time it, is late summer, early fall. Because we're going to start to see RSV here kind of trickle in kind of October-ish, November-ish. You can get this with other vaccines, not a live vaccine or anything like that. So easy to give with others if you need that. So that's another one. So those are kind of our triple threats that I just hit right there. Okay, pneumonia, I get asked a lot about pneumonia, and pneumonia kind of continues to evolve, and every time a new pneumonia vaccine comes out, they're hitting different serotypes of these. So pneumonia can be caused by lots of different strains. And so what this particular pneumonia vaccine is called Prevnar 20. It hits 20 different serotypes that can cause pneumonia. Now, there's another one on the market as well. I want to make sure I'm being fair. So there's Prevnar 20, and then there's another one that covers 21. I do have some patients that get both of these vaccines right now, and that is fine to do. Right now, probably the most common one that we see administered is this Prevnar 20. So who's eligible for the Prevnar 20? Really, anybody who's 50 or older, and even if you've had some previous pneumonia vaccines. So we have this PCV 13 and 23. Those are older vaccines. You are still eligible for this Prevnar 20 vaccine, and that does tend to last just a bit longer. There's also some younger populations that are eligible as well, but for you all, this is, in the 50 and older age group, you're all eligible for that particular vaccine. So just that second question there, I tried to include some common questions I get. So I received a pneumonia vaccine a few years ago. Am I eligible for another vaccine? Possibly. So like I said, some of those older pneumonia vaccines that you may have received, they're older. This one is newer. It's a little bit longer lasting. And so we do recommend that you get updated with that Prevnar 20.
How many years can you go, or when you get the pneumonia vaccine? How many years? You don't get that every year.
No, you don't. No, right now it's just like the Prevnar 20 is kind of my official recommendation. Yeah,
Okay.
yeah, and that is the confusing part because pneumonia, like I said, continues to evolve, and so we continue to see recommendations that change from the pneumonia vaccine. So I always say, like, it's confusing to pharmacists, it's ultra confusing to patients. And so it used to be that there were very specific guidelines about the years in between that you were supposed to get these, the pneumonia shot and all that. Now it's simpler. So now we just say, just get this Prevnar 20 or the other pneumonia vaccine, which I'll get the name for you guys. On that one, because that one has the 21 valent as well.
If it's been like 3 years since the pneumonia vaccine, would you recommend to update?
Did you get the Prevnar 20?
I have no clue.
You don't know. I would ask her, just double check with your pharmacist. The Prevnar 20 should be good.
Okay.
We just don't carry, we don't carry the other one, so I'm not as familiar with it. But there are definitely retailers that do. Okay, it's called Capvaccine, and it's a 21 valent. And that doesn't necessarily mean that it's better, it just targets different serotypes. So it's confusing because it says 21. The one that's been around for quite a while has been this Prevnar 20, not quite a while, but the longer amount of time. We haven't changed our recommendations at St. Luke's as to which one we highly recommend. But if you have a pulmonologist, they may say, like, I prefer you get Prevnar or Capvaccine. So you might want to have that conversation with them first before you. And again, talking with our infectious disease physician, he did say some patients want both. And so that's something else to consider. If they do hit different serotypes. I thought I would just touch on shingles because nobody wants to get shingles. So
Some of us have already had it.
yes, I know. I'm in that group too, but it's pretty brutal. So if we can avoid it, that's ideal. There used to be an older vaccine called Zostavax. This is a newer vaccine. It's more effective. It's just an easier vaccine. In that it's, again, just like a one-time, 50 ages and older, you get 2 shots. They do need to be separated by 2 to 6 months. The side effects for this one are not lovely. I will say that. They can kind of knock you down. So that's something to keep in mind. Not every patient, again, you're going to get a variety of side effects, but there is some malaise, I would say. After that, a question we get a lot, you received Zostavax years ago, can I still get the Shingrix? And the answer is yes. Zostavax hasn't been around for quite some time.
So this is a once in a lifetime?
Mm-hmm.
Okay.
Yep, once you get the shingles, you're good. The younger you get it, they say the better, but can't go back in time now at this point. I am seriously considering getting it when I turn 50. I'll say that. Yeah.
So if you've had shingles already, you're still supposed to get.
You certainly, yeah, I would definitely recommend you still get it because if you've had it before, that doesn't mean you can't get it again, and
Then I will certainly get it.
yeah, I know, because if you've had it, you know that it's just kind of brutal. Okay, sorry, there we go. I did want to touch just a little bit on the Tdap because we have had kind of pockets of pertussis outbreaks, which would affect you all in the Better Breather Club. So who should receive the vaccine? Pregnant women during every pregnancy. This isn't like a one-time thing, so pregnant women do need to receive the Tdap. There's some window of time that is best for that, and that's to protect baby from pertussis specifically. And then all adults should be receiving a booster of at least the TD but I generally recommend the Tdap every 10 years. And that's because we still have kind of pockets of populations that aren't vaccinating their kiddos for this. And so we can see outbreaks of pertussis. And so now pertussis is brutal. So you get it, there's really no treatment for it. It's just a cough and it lasts for like 3 months. So you're just coughing all the time. It's really terrible. No antibiotics, nothing like that. So it's also, I'll just give you this example. My daughter's, she was 10 last year, so she was eligible for her booster this year. And my pediatrician did recommend to vaccinate her 1 year early because they were seeing, kind of the breakthrough cases at that age group, because your immunity does start to wane again around that 10-year mark. So I just vaccinated her about a year early just to prevent that. We were having pockets that go through the Boise School District. So just some considerations there, not necessarily regarding anything other than just those recent pertussis outbreaks that we've been seeing, not just here, but around the country as well. So I did want to just highlight, we are at Luke's, we've been really working on expanding our vaccination services. We're not there yet, but we're getting there. That's part of my job. So right now we have 3 pharmacies. We have 2 pharmacies in the Valley that you can just walk in and get a vaccine at any time. COSM is one of them. Do you guys know about COSM? It's a Center for Orthopedic and Sports Medicine.
Oh, yes, I know that.
Big new hospital that's beautiful down in Boise. So they have a great pharmacist that's really great at vaccinations, really up to date on stuff. You can go and get any vaccine in there if you walk in. And then we also have Fruitland Pharmacy, which is, on the western part of the state, kind of bordering Oregon. We opened a new pharmacy as well over in Magic Valley. So now we have a Magic Valley pharmacy associated with the hospital, and they are a fully functioning vaccinating pharmacy as well. By the end of the year, we've been tasked with opening up Meridian and Nampa for vaccinating pharmacies. Boise's tough. They're very tight space there, so we're working through that. But we'll hopefully have system-wide immunizations here. Hopefully by the next time I come talk to you guys next year. So, okay, and that's all that I have. So, thank you for your attention. Any questions that I can answer? I'll get to your AFib there. Okay, good, yeah. All right. Well, you guys are easy then. It's quite the time right now. We're just trying to weed through everything and make sure we're communicating to our patients the right way and